fears are growing that it won't be possible to stop the global spread of coronavirus. Health experts have warned that the chances of containing it are diminishing as cases appear in more countries.
The coronavirus's rapid global spread has several countries scrambling to take emergency measures. Most recently, Japan, South Korea, and Italy have had a sharp increase in the number of cases. This novel coronavirus strain, officially named COVID-19 by the World Health Organization, was first discovered in Wuhan, China in late 2019. The outbreak was declared a public health emergency in February, and patients have tested positive for the virus in more than 40 countries on 6 continents.
This virus has pandemic potential, and WHO is providing the tools to help every country to prepare accordingly.
We saw this acceleration, which is now so obvious to everyone. You know, we started off with 25, 50, 100, several hundred, 1,000, 5,000, 10,000. So
rallies in Arizona, Colorado, Montana, and Washington state were expected on Sunday, following the earlier protests in half a dozen states. Agitation for easing restrictions has grown, despite the risk of a COVID-19 resurgence posed by reopening too soon. U.S. President Donald Trump has signaled support for the protests. The U.S. is the epicenter of the COVID-19 crisis, with over 735,000 cases and some 40,000 deaths. But signs have emerged that it is reaching the apex of the outbreak and that infection rates are slowing in some states. Governors in several states have begun discussions to plan reopening amid signs of the slowdown, but other regions remain under strict lockdown. California Governor Gavin Newsom was the first in the nation to issue the statewide stay-home order, shuttering the country's most populous state since March 19. Neighboring West Coast states Washington and Oregon followed suit days later, putting their combined 11.5 million residents under a stay-at-home order since March 23. New York Governor Andrew Cuomo announced this week that the state would extend its stay-home measures until May 15. Speaking at his daily virus briefing on Sunday, Mr. Cuomo urged caution to residents, beset with cabin fever and desperate for their state to reopen.
So far we're seeing mostly older people who are dying, which from a public health perspective is better than having it be younger, healthier people. So we're going to be closely monitoring to see whether that profile changes. But for the time being, this is more like what we see with flu, where it's the immunologically compromised people who tend to be older adults who are most affected.
The coronavirus can also be fatal to critical care health workers who are repeatedly exposed to the virus for an extended amount of time. The U.S. government enacted measures to contain the spread from China. On January 31st, the administration announced foreign nationals who had traveled to China would be denied entry into the United States.
The President has signed a presidential proclamation using his authority pursuant to Section 212F of the Immigration and Nationality Act, temporarily suspending the entry into the United States of foreign nationals who pose a risk of transmitting the 2019 novel coronavirus.
The coronavirus has had significant impact across almost every industry. Worldwide stock markets have fallen over fears of a pandemic. Japan announced they would close schools until April, and the 2020 Summer Olympics in Tokyo could be impacted because of the coronavirus. And those who study and work on infectious diseases are still unsure what will happen next.
So a lot of what we're saying now is based on current data, and as we get more data that come in, some of these initial characterizations of the disease may change a little bit. And again, that's not going to be because people were not being truthful earlier. It's just that as we get more data, we can be more precise and we can be more accurate.
right now the risk to the American public is low, but, big but, That could change because this is an evolving situation. And if it evolves into a true global pandemic, then we would have a very serious problem here in the United States.